Hey everybody, on today's episode, you'll hear physical therapist Peter Langlois talk about the secret to solving foot pain and knee pain and why those things aren't typically caused by what you think. You'll also hear him talk about arthritis, the kinetic chain, plantar-fasciitis, and so much more. We call Peter the joint whisperer around here, and you'll soon understand why. His knowledge in this field is unbelievable. The way he thinks about these problems and the results he's been able to give our clients are truly amazing. So without further ado, here's the episode. Enjoy.
All right, so we're here with our very own therapist, Peter Langlois, who's does a lot of great work for our clients, and especially with their joints and their hips and knees and feet, and to the point where I basically call him the joint whisperer. So we have the joint whisperer in the flesh here to talk with us. So we've spoken in the past about arthritis and how it's all connected, how the body's all connected. I refer to it as the kinetic chain, very popular word right now, praised amongst strength coaches and physical therapists and all sorts of professionals. Basically, the idea of how the body all connects together from one joint to the next, from the top to the bottom to the top. And Peter's absolutely fantastic at solving a lot of these issues for our clients. So welcome, Peter.
Thank you for getting me on the podcast. It's kind of fun.
Absolutely. And honestly, I don't know where this conversation is going to go, and I think that'll be part of the fun of it. So you get to listen to us just kind of rant and talk about wherever this conversation goes, but kind of general theme, arthritis and kinetic chain. We'll see where it goes. So how the body's all connected, and you're especially good at foot problems. And I think that's a good place to start. How basically a lot of people will have foot pain and they think it's just the foot and they'll try to work on just the foot. But as you often point out to people and as you work with people, that foot pain is being caused by something 1, 2, 3 joints or more above the foot. So
right. So a lot of people have come and they'll say, like the bottom of my foot hurts. And like, a lot of people deal with like plantar fasciitis and stuff like that, or just arthritis in the knees or just knee pain in general, and that usually that'll be solved or be caused by something that's going higher up in the food chain, such as the hip or the lower back or something like that. So being able to identify where it's coming from is the most important part to solving the problem lower down towards like the knee or the foot or something like that. Right. So being able to identify where that's coming from is just as like, you can't solve the problem unless you know where it's coming from. So otherwise you end up getting like this reoccurring issue over and over again, and you can't figure out why you haven't been able to get rid of this one problem.
So people keep treating the foot, going to doctors, going to therapists. Everybody's looking at the foot, when in actuality, it's somehow happening all the way up into the hip oftentimes.
Yep, hip and usually somewhere in the lower back. There's usually something going on there that affects that whole side.
So how does that work? How can something that's happening in the lower back and the hip cause pain all the way down to the foot?
Well, for this is a good example. So if you're having, say, knee pain, right? Let's say on the inside of your knee, that pain is being caused by a weakness higher up in the food chain. So if your hip drops, on that one side that we're having pain, you're going to have that more of an angle from your hip to your knee, and it's going to cause some of that, some of that pain on the inside of your knee, as well as being caused by, some arthritis and stuff like that on the inside of your knee. So that's usually how you can identify it, and then correcting it, and then trying to correct that, right? Mm-hmm. Trying to get more of that knee to come, more laterally.
More outward,
to be able to help correct and have the joint working in the correct plane and the correct plane and the correct direction that it's supposed to be. So our joints aren't meant to be, off to one side. They're created so they're working in more or less a straight line. So once you get the joints working in a straight line, then usually it'll be able to solve some of those pain issues.
And that's a great example in what we've talked about in previous episodes about arthritis. The arthritis might be there in the knee, and the person might be quote unquote bone on bone, but also contributing to that is the fact that because their hip is weak, their hip drops, which causes kind of more of a sideways force on that knee over and over again as a person's just living their life. So they're constantly getting this sideways force on their knee. By the way, and the knee does not like sideways forces, and it does not like rotational forces. The knee wants to go front and back, bend and straighten, go forward and backward, and especially if it has arthritis. And that's it. Like, it does not deal well with sideways forces and rotating. Now, of course, when we're younger and there's no arthritis, there's a lot more give. There's a lot more, you can get away with a lot more when you're 20 and your joint is, nice and fresh and working properly. But as we get older, we get arthritis, we get imperfections. Those movements that aren't so beneficial then are often what create the pain. And so you might have a hip weakness when you're 20 that might show up when you're 40 later on. It's going to keep amplifying and amplifying, but it's the idea of that sideways and rotational force from a hip weakness that's going, that then you get pain on the inside of the knee. Right.
And I see a lot of young athletes from time to time, and they're having those issues right from there. It's like, well, address this now so that when you're later, you won't have a lot of that pain and issues later on. So I have a lot of, like the junior high, high school, a lot of them already have like coaches and stuff, but I'm like, all right, educating their parents or to be able to say, okay, if we help address this now when they're 40, they don't have to deal with as much pain as someone who wasn't addressing this before.
Right. And so really these problems begin very early in life. Sometimes even childhood, and as teenagers, it's doing walking lunges and squats and all these things over and over again, and the hip drops. And you'll see this with young people if you see them in the gym or you see them in the weight room. They'll be doing lunges, and sometimes their one hip will drop on one side or the knee will turn in on one side. And by the time they're 40, it's going to come back with a vengeance. Right now, what we're seeing is a lot of the people that took the step aerobics classes in the 80s and 90s now are in their 40s, 50s, and 60s, and they're dealing with all sorts of issues from just repeated group exercise classes doing step aerobics in the 80s and 90s. Another great example. So the main point I think we're trying to get at is the arthritis issue and the joint pain issue is often very holistic, right? And it's not just what we see on an x-ray. It's because of the things that are happening above and below, and sometimes several joints above and below wherever the pain is.
Absolutely. It's kind of like if you look into something very detailed, you may not see the bigger picture of what's going on. And the body is so interconnected. You can have something like going on in your shoulder be affecting you down on your foot. I mean, that's just how the body works, right? So, I mean, we need to just kind of be able to take a step back and just like go, okay, I see why you're having foot pain here, and I see the foot pain here. All right, let's trace that back up and be able to identify the problem higher up in the chain. Meaning, either is it coming from the knee, is it coming from the hip, is it coming from the back or shoulder? Is it because is it the muscles in your breathing that causing some of the problems, which I've seen? Yeah, went through this one training, and they were saying that was what was causing. The muscles were not allowing the lungs to fully expand, being able to, kind of hunch them over, which is causing some of the back pain, which is causing some of the hip pain. Okay, now that hip pain is really causing things going down the leg and affecting the knee and the ankle. And now their foot is, more flat and pronated, which is kind of like
the foot turns
having
in.
your ankle come, closer to the ground. Mm-hmm. You're on the inside. So yeah, it's kind of interesting how the whole body is interconnected like that. So a lot of times, what I have to do is just kind of step back and see where is the problem coming from, and then okay, we'll address this, and we'll start higher up in the food chain, what I call it, to explain to some of our older patients. So be able to start higher up in the food chain and just kind of work our way down to get more specific.
And so then we've talked a lot about how hip weakness and hip problems can cause knee problems. Then how does a hip problem affect the foot? I mean, that's pretty far down. Mm-hmm. So how does that happen? Why do people have foot pain when the problem might be all the way up into the hip?
Right. And for most people, it's usually the hip is a kind of really a mobile piece of equipment we have, right? So they can rotate sideways, they can rotate forward and backwards.
The hip can.
Yeah. And so if the hip is off and stays off either, tips one side to the other or forward or back, that puts a strain on some of the other muscles, and that could cause potentially knee pain, which could also be causing that knee to be off either one way or the other, either inside or outside. Sometimes it's a matter of hypermobile, keeping the knee kind of bent backwards.
So the knee joint is moving too much. It has too much freedom of movement.
Not necessarily too much freedom of movement, but because of the way that the hips are, could be putting more of a stretch on one side than the other, and then causing some of those issues in the knee, which then the ankle has to compensate for, because the ankle has to compensate for our load bearing, right? They have to be able to compensate. So if the knee has more mobility in it or not centered, then the ankle has to compensate to be able to keep our weight underneath us.
That's a great point. So something that happens up into the hip then causes a response at the knee, which something then below the knee then has to compensate for
exactly
the misalignment or the tension that's going on at the knee. Something has to give below and change.
Exactly.
And then there's the person putting their foot into the ground, and then they have tension in the bottom of their foot that might be plantar fasciitis or some type of other foot problem or foot pain.
This is so good. You're really
now I'm getting
into this, are you?
Okay,
so
this is the key to the joint whisperer, right?
So plantar fasciitis, because you brought this up, so I want to kind of touch on this real quick.
I'm going to go grab a coffee and now just let you go.
So the reason why is because so many Americans at one point or another are going to have to deal with plantar fasciitis. And it's more than, I would say, close to 50% of Americans that deal with it at least once. I don't know. That's not an accurate statistic, but it's probably pretty close.
That's not from peer-reviewed evidence. That's from basically
what you see. That's just from experience.
Yeah,
exactly.
From what you see, yes.
And so a lot of it, a lot of people are going to have that, typical, and they'll just say, I have pain on the bottom of my foot, and it'll be somewhere in the arch. And it's in most of the cases right on the, for you guys on YouTube, it'll be right on the inside of the heel, on whatever foot you're having it on. Sometimes it's both. And usually that's caused. And so here's where this kinetic chain will come in. So we're going to chase that up, and then that'll be mostly on the inside of your calf, maybe like halfway up on the calf, on the inside of your calf. So the inside of your leg, halfway up, and you're going to find a pretty tender, really tight, pretty tender right there. And then you're going to be able to, once you start releasing that, then you can kind of go higher up into the hip, because usually if you're going to have really tight hip on that one side or lower back. So once you start releasing the lower back and the hip on that one side, you'll start releasing some of that tension on the bottom of the foot, because everything on the back of the leg is really tight. And so once we release the tightness on the back of the leg, now your calf isn't gonna have to work as hard, and now you can release the tension in the calf, and then release the tension on the bottom of the foot.
How do you release the tension? Is it stretching?
So
is it myofascial release? Is it foam rolling? Is it
could be
a tennis ball? What is it?
It could be a lot of everybody's body is going to react differently. A lot of, if you go to a podiatrist or something like that, or even a physical therapist, they'll have sometimes they'll have the percussion machines, either like a Theragun or some sort of massager. They'll be able to give percussion and vibration, and that'll kind of help loosen a lot of that up. I saw my podiatrist friend last week, and he was like, "Let me show you this new tool." I was like, "Oh, I don't know if I want to." And now releasing it isn't always the most isn't the most pleasant, but it's
right.
You do get quite a bit of instant relief once you do it. So usually you want to do like a either trigger point release, or which is kind of like just a hard pressure to that one area to kind of release the muscle, or vibration. Heat is, I found, really helpful to kind of help loosen that. And then after you do those, then you get into your stretching. So you want to do like the massaging first, and then the stretching after, to try to help elongate those muscles again, and that'll kind of help.
That's interesting. So why massage first and then stretching? Why do you like to use that?
If you think about the muscle, it's kind of locked up, or a lot of times what happens is those muscles are bound on each other. And so you're using the trigger point or the vibration or the percussion to try to break up that bind, right? And then once you break it up, then you want to stretch it out to elongate those muscle fibers. And that'll kind of release some of those, release the tension on that muscle fiber.
I think some people get frustrated with stretching and flexibility work and things like that. It's either they don't get anywhere, or it can cause more pain and discomfort. So I think what we're talking about here now is sometimes you can just jump in, stretch a muscle, and you get instant relief, or you get the outcome that you want when you're stretching it. But then other times it's almost like you're just pulling something really taut. You're just kind of creating irritation on something that's not ready to be pulled tight, right?
Right.
I think that's what we're getting at. It's sometimes, not always, but sometimes the muscle needs to be prepared more. It needs to be warmed up, or it needs some myofascial release needs to be done. So when we talk about myofascial release, it's kind of the connective tissue that gets bound up. And let's talk about that here in a second, so people know what we're talking about. But so something has to be done to kind of prep the muscle, sometimes in advance before it's stretched. Right.
I mean, it's just like your typical elastic band analogy, right? If you stretch a cold elastic band, it's going to break. It's not, you're not going to get a very good result.
It's a good analogy.
Right? So if you don't warm the elastic band up then before you start stretching it out, then you're going to have some issues.
It's a good reason to do a general warm up before exercise, correct, as well, just to increase body temperature, just to get the blood pooled into the skeletal muscles, so that let's say if you do need to do some stretching before the workout, where sometimes that's a good way to go.
Right.
Ideally you want your muscles warmed up in some fashion,
right,
before you go and do that.
Right. This is every runner's, least favorite thing to do is like stretch before or after. They just want to go and run.
Right.
So, so it's like, all right, look, take some time, stretch before you're going to run, and then, make sure you do a good cool down stretch. So that way, kind of eliminate a lot of that stuff. Because all they want to do is run and then sit down on the couch. I'm like, oh no, don't do that.
But the worst thing for our joints, for our back, for everything, it's the worst thing we can. Well, not the worst thing, but it's problematic to exercise and then just immediately go sit down.
Yeah,
right away, right?
And oh god. So this is good. So when especially and I've done quite a bit of running in my career, and the worst thing to do is after a run or in the middle of a run, stop and sit down because it's the hardest thing to get back up from.
It is.
It's the hardest thing. And it could be then you're stiff, your muscles lock up on you. It takes you 3 times as long to try to get, even back to halfway where you were before you sat down.
And even to the point where it's now recognized that sometimes people do an activity, they'll play basketball, they'll run, or they'll do whatever it might be, and they think that the activity caused the back pain or the knee pain or the hip pain, whatever it is. In actuality, oftentimes it's the fact that they did an activity, they got their body warmed up and flexible and pliable, and then they go and sit down into a flex forward position, and then their body kind of forms to that position as it cools down, if that makes sense. Because then you got the body very loose and mobile, and then you put that loose and mobile body into a very bad position before allowing it to kind of come back to normal, right? And then it kind of forms in that bad position, and then they get back pain afterwards. After a result, they think that it was the activity, but actually it's the activity and then going and sitting down immediately. Right. If that makes sense. I remember Mackenzie talked about that quite a bit. For those of you who are into Mackenzie's stuff, for those therapists listening, talk about that quite a bit, and we see that all the time. Maybe very simple anatomy and pathophysiology. So what these knots are in our body, these trigger points. People hear all these words all the time. What is this? What are trigger points? What are knots? Releasing a muscle with a foam roller or a tennis ball or a vibration. There's all sorts of different ways to do it. I like foam rollers and tennis balls. Yeah. What's this connective tissue?
You know why I've gotten away from rollers and tennis balls aren't too soft, first off.
Right.
And so you got to use a lacrosse ball.
Okay.
But most of the times when you're working especially around the hip flexors, it's really hard to do with a foam roller to try to get into those areas.
Yeah, you need something that gets deeper, right?
And that's why you'll see those percussion machines have gotten as popular as they have. One, because they're easy, anybody can use them. They're just plug and play. You just be able to just turn a button on and you can.
Are those new massage guns that you see?
Yes.
Ah, gotcha. Okay. Yes. All right.
They are extremely helpful.
Really? Okay. Good to know.
Because by doing, and then what it's doing is the vibration in general kind of helps, because with the muscle, those knots you were talking about, they're kind of like muscle fibers that are bound up on each other. Okay, and you can use trigger point release, which is a high pressure, which is basically using that pressure, squeezing the muscle, and then trying to have it to release out. So it's basically that little knot kind of giving up, if you will, and releasing instead of binding on each other. What the vibration does, and vibration in general, it just kind of releases and relaxes a muscle, right? Because you're just kind of sliding those muscle fibers between each other. It's exactly why if you ever got like a foot massage, they put a little vibration on the foot, the foot pedals or whatever when you're getting the massage or whatever, because it helps relax those muscles.
And and what's important to understand, I think, so the binding is also, they can be called trigger points, they can be called knots, or the fascia basically binds up. I'll go into this real quick. So the fascia is, and you can correct me here in a second, but I do want to address this part. So basically we have connective tissue that forms over the muscles. It's kind of like that silky stuff on chicken. It's the exact same thing. And what that does is that connective tissue binds together and within that fascia, within that connective tissue, are basically nerves and blood vessels. When you release that connective tissue that binds up, then it opens up electrical signals, it opens up blood flow, and then the pain is caused by that bundling up of that connective tissue into knots. And that's why these knots are so painful, because it's basically a bunch of microscopic nerves that are all bundled up together. So when you press on it, it creates a lot of pain. Then, of course, when you release it, then a lot of pain can be released. But there's the fascia, but then there's also the muscle below it as well.
Right. So typically, you're not going to see a knot in fascia, because fascia is like that connective tissue. It doesn't really have, you're not going to be able to move fascia. What happens is the muscle attaches to the fascia and it gets bound up on that fascia. So it's the muscle that has the knot, not necessarily the fascia. And then you're releasing the tension in the muscle and releasing the bind from the fascia to the muscle. And that's where because typically what happens is the fascia will slide over the muscle, right? And so that you're making sure that fascia will be able to continue to be able to slide. You have muscle that's constantly sliding over each other as they contract and release. And so you just got to make sure that they're still able to be able to move, slide like that.
So as people have a bunch of basically a fascia buildup, and it really restricts the way that the muscle is supposed to function then.
Oh, not only just the muscle, but you kind of touched on it earlier. Is so if that muscle is really tense, it's going to bind up and potentially compress on all the nerves that run underneath it, or typically run underneath it. And then here's a good example of it. I just worked with someone the other day. She had a lot of those knots right in her kind of a shoulder, between her shoulder and her neck, and she was getting pain and tingling down to her fingers. Right, this is a good kinetic chain as well. So by releasing the knot on her upper trap and shoulder and neck, then you're not only smoothing out the tissue up on there, releasing the pain up there, but by releasing that pain, now you're decreasing the pressure and the shooting pain and the tingling and the numbness going down to the hand. I mean, there's other issues that could be also affecting that, but that pretty much being able to release that muscle was able to, reduce, or if not eliminate, the tingling down in the hand.
It's a great place. I think the main point there is, so tingling numbness into the hand, it could be, people have heard of carpal tunnel. It could be something up in the elbow. It could be something in the shoulder. It could be coming all the way up to the neck. And then what will often happen is people will get an x-ray because they have tingling numbness into their hand. And then the x-ray will show that, yes, you have arthritis in your neck or you have bulging discs in your neck. And then they go and get neck surgery or all these things. And the first thing to look at is, okay, what could be the other things there that could be causing that tingling numbness into the hand? It might be something as simple as, the muscles around your neck, your upper traps are knotted up or shortened, and that's causing a tingling numbness into the hand. So start with that kinetic chain process first. Try to solve that problem first before looking into surgery. Now, surgery, or looking up into the neck from an orthopedic perspective could be what's causing the problem, but there's lots of steps to go first before going all the way to, I have bulging discs in my neck, I have arthritis in my neck, and that's causing the tingling numbness in my hand. I had one person recently, clearly she had, nerve root problems to the point where she was getting tingling in her hand, and there was clearly something going up with the neck. Simply by providing corrective exercises that brought her head and neck and back into alignment, that tension was gone. I formally then tested her nerve root from there. And then within a couple of weeks, it was basically completely gone.
Yeah.
Completely solved simply by correcting the alignment of her neck. And so then the nerve root was getting pinched up in the neck because of her posture, right? And then she did a great job in doing the corrective exercises. Her neck and back went into great alignment. She looked really good after doing the exercises for a couple of weeks. And all of a sudden, then the tingling numbness into the hand was gone as well. And it hasn't come back. And so then, okay, good. That's when probably we don't have to worry about looking all the way towards, long, rehab to address this, nerve root problem up at the neck. We don't have to worry about the physical therapy involved. We don't have to worry about looking into how much arthritis is up in the neck and all these things. Simply by fixing the alignment, corrected the problem in that case. And sometimes it's releasing the muscle tension up into the neck and around the neck and to the shoulder can help a lot of people simply by starting there. We can, a lot of problems can be solved by just doing something more simple like that.
Right. And it is. And I feel like we're going to be seeing a lot more of that in the coming years, because as people are getting their heads down, looking at their phones, working on their computers from home, that forward neck posture is going to be more and more prevalent. And we're going to be seeing a lot more of that. And so as that neck comes forward, then you're putting everything out of alignment again. And then now you're going to be having more of those symptoms, either, through dizziness and vertigo or, pinched nerves, all that stuff is going to affect it.
So a lot of that is teaching people how to bring their body back into alignment. I'm a big proponent of corrective exercises, recognizing that we are going to do these things throughout our lives. We are going to be sitting at work. We are going to be we are going to be looking down at our phones. Our phones have become how our life, how we interact with our life in the palm of our hand, for better or for worse. That's the way that's how we interact with work. That's how we interact with our family. It's become our social everything in the palm of our hand. But what that does is then it brings our head forward. So then we have to find a way to then bring that back. We can try to get people to do something with their head while they're, but
I found a really good exercise as of late, or corrective. I won't even call it, well, yeah, I guess I'll call it an exercise. And that's just having people stand with their backs against the wall. Right? Because they realize either where they are and where they need to be. Right? Because once they're in the, have their feet and their back against the wall, they'll realize, all right, I am really leaning really far forward. And those were, and then, so then to be able to bring their head and their shoulders back against the wall helps them keep themselves back in alignment, kind of cues them to bring themselves back in alignment.
So then the wall gives them some feedback as to where they need to be. What are some other things? Let's just get right into this. So whether we're talking about, foot pain or muscle tension or posture, what are some simple things that people can do on their own to prevent these sorts of problems from coming up?
I'm always a big proponent of yoga for people. Some people do them in the similar things in Pilates as well, but to be able to just keep that mobility in the hips is really kind of important, because that's where everything usually stems from. I typically look at from the hips down and the hips up. That's kind of how I assess. And so from there, if we're just talking about posture, that's a great one that I've discovered as of late.
Start at the hip?
No, well, the wall, using the wall is the one that I use for posture. So that's just a great one, just to help give that feedback of where they are and where they need to be. The other one I like to try to use is just kind of being able to use a belt to help stretch out the hamstrings. So usually that's you're pretty tight on a lot of people. Mm-hmm. So if we can try to help stretch those hamstrings out, then we can kind of help get the pelvis moving a little bit more, because it's usually locked up in one way or another. Mm-hmm. So trying to figure out where that limiting one, and typically it's usually in that posterior side. So stretch the hamstrings and stretching that lower back to kind of make sure that people can keep their hips mobile.
So basically the hamstring pulls on the pelvis pulls downward, and then you have less motion in the hip.
It's rotated back. Yeah.
Right. Rotated back. Yeah. And so then their back flattens out, their pelvis kind of tilts, their tail kind of tucks underneath them, if you will. And then that can cause problems all the way down the kinetic chain into the foot, can cause back problems, certainly. And a lot of times hamstring tightness is caused by sitting as well.
Usually those people will say that they have lower back pain.
Yeah. And sitting, of course, creates a lot of hamstring tightness and shortness, which then, of course, then the tail tucks underneath. Whereas what we really want is the tail, if you will, to be arched backwards. And so you have a nice arch in the lower back, which is a newer thought in the past, probably 10, 20 years. The thought used to be to flatten out the back. Why that was the case, I don't know. I've heard stories, this is before my time, but we know, since I've been studying the human body, like you want that nice arch in the lower back to absorb all that shock. It's kind of like springs in the car, that it's a good shock absorption mechanism. And a lot of times that lower back will just flatten out and you lose that shock absorption capability. Now, to your point of the wall, and I think you've discovered the wall as of late, because of the people that we work with basically from age 80 to 95, and with our clients that we work with. And I think the wall, correct me if I'm wrong, probably provides a lot of great kind of cueing to someone who's 85 to 95 years old, and really shows them where they need to be. And then here's the powerful part of this. I've seen you be able to take people up to age, they're 92, 93, 94, and you correct their posture tremendously. So then you have a 94-year-old standing more upright, and I didn't realize how tall they were. And all of a sudden they're towering over me when they were shorter than me as of, it's like, I saw you a month ago, Mr. Smith, and now you're towering over me because of the great work that you guys do together with their posture. Right. And all of a sudden they're towering over me like, this is how tall you were. And it's not just about losing height with age. It's not just about we lose fluid in our discs, and so our spine kind of shrinks down as we get older. That is age related, but what's not the purely age related part are the muscles pulling us into a certain flex forward position. And then when we correct that, when we get people lined up and we get people in a better posture, we can increase people's height, especially as they're older. It's almost like the older you are and the more flex forward you are, the more we can improve your posture and make you taller again. Well, with doing the work, putting the good work into it.
Right. And part of that goes into their balance, right?
Yep.
And so if in a lot of those cases, their hips were rotated forward. So it automatically puts a stretch on the hamstrings, meaning that they're using their quads a lot more, and their quads are a lot more tight that's kind of pulling their hips forward. And then there's also a weakness in the trunk, right? And with that weakness in the trunk, everything's just kind of rotating forward. And as it's rotating forward, they just maintain that posture. And so that's why you see a lot of old people kind of all hunched over, because they're gotten weaker in the core. They're not strengthening their back. The hamstrings are really tight, and you don't see them using their toes as much. They're all on their heels.
Yes.
And so by correcting their posture, in correcting that forward rotation in their hips, then we can get them standing taller. Now their balance is better. It's like, oh, there's the magic, right? So because then's where we get them taller. Now their balance is forward. Now they're able to use their toes a little bit more instead of being more on their heels. And then just that's part of the magic of the human body, really.
and here's the real magic. You've just linked basically the trunk, the pelvis, the hamstrings, all the way down to the toes, and how that relates to a balance and fall problem. Because it gets that complex.
Right.
Whether it's balance and falls, whether it's arthritis, all these common things that people experience on a regular basis, all because of the problems that are happening way above or way below wherever you're looking at. Or sometimes these more orthopedic joint alignment, musculoskeletal type problems causing a balance problem. And then people are becoming overly reliant on putting weight into their heels as they're living their life. And then they fall backwards. They have nowhere to go if they're already back on their heels.
Exactly.
And then they can't respond. And so then you have an 85-year-old that keeps falling and landing on the back of their head, getting concussions and head injuries and all these, sorts of problems. And because they're way back onto their heels. One of the contributing factors, it's not the only thing, but one of the contributing factors is this postural problem.
Absolutely.
And we see that all the time.
And then usually there's a hip weakness in there that makes their toes kind of flare out to the side. What we usually call, some people call it like the duck walk.
Yeah.
So when their heels are really close together like that and their toes are out to the side, and as they're walking, and if they're on their heels at all, they're just going to go backwards. They're going to lose their balance backwards because they have they're not able to shift their weight onto their toes. You can try it. This is kind of nice. So put your heels together and put your toes out, and then try to stand up like that with your heels together. It's very difficult to be able to keep your very difficult to keep your balance. And it's usually because of a weakness in the hips that they're flared out in the begin with. And you see, most of the time, you'll see more of just one foot flare out more than the other. But when they're both flared out and dramatically, that's when it really puts a real stress on your balance system because you're putting yourself at a mechanical disadvantage.
What we're talking about here is, these are insights from us working with people all day, every day, who have these sorts of challenges, people who are, 70 to 95 years old, day in, day out. These aren't things you're going to pick up and learn in school. These are the things that you pick up on basically as you work with people all the time and you see these patterns. And I think the other thing we see very often is the things that older people will do are so physically demanding because their movement changes. And when I try to do them, right, I can't physically do it, or it's very difficult. So standing up from a chair without getting to the front of the chair, or as you talk about, putting my heels together and turning my feet out and then just trying to stand straight up from a chair.
Right.
It's very physically difficult to do.
I'm going to see a lady today that you're just spot on. It's like they, because of the way that their posture are, or the way that their feet are, or where they place their feet, makes things so much more difficult than what they really need to be. But that's not the hard part. The hard part is trying to get them out of that, right? They're teaching them and be able to keep them in a consistent way to be able to say, all right, look, I see how you're doing it. This is an easier way for you to do it. How can we keep this a part of consistently for you to be able to do this for the rest of your life?
Because they've been doing it for so long and it's been gradual. It didn't happen overnight.
Right.
And kind of the other theme along with this is that an orthopedic problem, right, or a joint problem, a musculoskeletal problem, will then turn into a movement problem. You can correct the joint or the musculoskeletal problem. You can correct the pain, but the movement problem will still be there. Great example that I think people see us all the time. People who have gotten hip replacements. they have hip precautions where they can't lean forward and all these things. And what they do is, they stand straight upwards so that they're not leaning forward and bending at their hip because of their hip precautions. And then 2 years later, they're still standing straight up, trying to this very difficult and impossible task of standing straight up without bending forward. Their hip precautions are gone. Their hip motion is great. They've had great physical therapy. They've done great work with their joint, but they're still not leaning forward when they stand up. So they're still moving abnormally because of their hip replacement from 2 years ago. Right. And we see that all the time. It's just a good black and white example of the sorts of things that we're talking about. And we see this with elite athletes too. They have knee surgery, and when they walk, their knee doesn't straighten out all the way, even though they have perfect motion, but the movement has changed. It's a connection up into the brain that now a movement pattern has formed that's become abnormal because of an orthopedic problem. And so I think to kind of bring it back to the arthritis and the kinetic chain, these are the sorts of things that people live with. And as they live their life, it's these sorts of complex things that happen that often go underlying. It's an onion that needs to be peeled away to understand about for each individual. And so then the person will have arthritis in their knee and their hips and their back and their bone on bone, so to speak, and they're getting pain and discomfort. But based on what we've just talked about, we see how complex this all is. It's not as simple as, well, I have a joint that's worn down. Well, there's a lot more going on there than just that. And so here's the good news. There are a lot of things that, one, can be done in the moment. Even if you're 85, 90, 95 years old, there's still things that can be done. And there's lots of things that can be done to prevent these sorts of problems in the first place. You talked about Pilates. I'm a huge fan of Pilates. You talked about yoga. I'm a huge fan of yoga, even though I don't like to go to yoga classes myself. And so for people that are not, and that's why I like corrective exercises, it's almost like, okay, where am I tight that I need to be stretching, and where do I need to be stretching on a regular basis?
I would say the majority of people don't know where they're tight or how
that's another point. And that's why yoga is so beneficial, right? If you go to a yoga class once or twice a week, if you're a runner, you're a triathlete, if you're anything like that, if you don't know where you're tight and where you need to be focused on stretching, go to yoga, go to Pilates, because your body's going to break down if you don't address the flexibility problem, the postural problem, the kinetic chain problem. And yoga and Pilates are a great way to address that.
That's exactly what we do, right? We're able to identify where the people are really tight, that they have no idea they were tight there. Right? Because most people, I'd say most people, so they just know they have a problem.
Yeah.
Sometimes they'll know, I was like, yeah, my hip's kind of tight. Okay, but where is it tight? Is it, so then once you start exploring, it's like, all right, this is why, that is really tight there. It's like, yes, that's what's causing this, which is causing this. And you can, once you're able to identify, all right, this is what's causing this, is what's causing this, and you're able to identify the problem, then all right, now you're in, right? Now then you can solve the problem, and not just the actual immediate pain point, right? You're solving the entire process. Versus just, one little pain point at the bottom of the foot, right, per se. You're solving the problem, which is causing the pain, right? So you're not just causing the action, you're causing the whole cause of it.
So it's far more complex than that pain in the bottom of the foot, and use ice and heat and roll a cold soup can on the bottom of the foot, which can get you somewhere and sometimes solves the problem. And I love it when people will go in to a healthcare provider and they have pain in the bottom of their foot, and the healthcare provider says, well, stretch your calves. Let's just start with that. And voila, it solves the problem. Because sometimes it is just that. Sometimes people just need to stretch their calves because they never have. And they have, their ankle motion is very minimal. Mine included. So I have to stretch my calves all the time and work on my ankle motion all the time. And once they start stretching their calves on a regular basis, then the bottom of their foot problem goes away. But sometimes it's not as simple as that. Sometimes you got to go up higher and higher and higher. But I think too often, to your point, people are go down this path of, long drawn out physical therapy or long, months and years of a problem where they're focusing on the bottom of the foot itself. They're rolling out a cold can of soup or whatever it is, on the bottom of the foot.
Those cortisone shots.
Cortisone shots into the foot. Whereas let's try looking up. Mm-hmm. Way above. Let's look into the hip. Let's look into the back. Let's see what's happening up here that's causing the problem in the bottom of the foot.
Because all they want is like the relief, right? That's what they're looking for, because it's pretty painful. And if you haven't had it before, it's a special kind of suffering
and debilitating as well, because it's the bottom of your foot. You can't avoid that.
What do they say is like without the hoof there is no horse,
right?
Right. So it's like always you gotta be able to stand on your own 2 feet in order to get around,
right?
So
we have other things that people can do. Pilates, yoga, a good place to start. Some people are not group exercise people. I know I'm not generally. I'm good with teaching them, participating in them. I like to work out more individually. So where are some other things people can do?
I like those, but I mean, those group exercises are really good because they'll kind of make sure they kind of hit all the points.
Yeah.
But I mean, me personally, I like to try at least a little bit of everything. So I'm going to try, I've tried just about everything once. I've even gone.
That's a whole nother conversation for another day.
I've even gone, I've done a Zumba class once. That was.
Oh, yeah. Yeah.
It was interesting. I found out I wasn't very coordinated.
Oh, I mean, you could probably do a whole conversation about Zumba and the benefits of Zumba. Absolutely.
So, I mean, it was fun, but I was like, okay, well, maybe I'm not the best coordinated dancer in the world. So.
Right. So maybe some people can do, staying against the wall. Does your head touch? Does the back of the head touch the wall? Let's start there.
That's a good test, right?
Right.
And that's a good test for just about anybody.
So what should touch the wall?
I did that with my nephew, just so.
Uh-huh.
Usually when especially for our older patients, I know that there's already an issue. What I'll put is a small pillow or a towel roll, right in their like lumbar area, right above
their lower back.
Yeah, right above their bottom. And just have them stand against the wall that way. And they'll notice that their shoulders and their head aren't touching the wall. Mm-hmm. And so to be able to get them straightened up, so it kind of forces their posture a little straighter. Mm-hmm. It stretches their abdominals, stretches, all the hip flexors a little bit, depending on how where they are. Mm-hmm. But it just kind of helps with that, biofeedback to kind of get their posture straight.
So I think what we also see here is just the level of skill that is required to solve a lot of these problems. Sometimes there are some simple things that people can do, but it's also, there's a lot of specialists now out there who they really get into how one part of the body affects the other, whether they're strength coaches and personal trainers, whether they're physical therapists, chiropractors, whoever they are. This is becoming, people are recognizing the benefit of looking at several joints above, several joints below, wherever the source of the pain is, looking at the kinetic chain, looking how the body is connected. It takes a lot of skill, and there are people that are passionate about this, and really invest a lot of time and energy to study this, because it really does help a lot of people when you look at the body as all connected. And so the specialists are out there. And so then, you're one of those specialists, absolutely, that you're able to solve a lot of joint problems for people. That's why I call you the joint whisperer. It's like, okay, Peter. Well,
yeah, I got this guy you need to see.
Exactly. How many times we had that conversation? I'm very much big picture as far as the movement, and then you're able to go in with a lot of detail. And then as we work together, we can help a lot of our clients, because you look at their overall big picture movement, but then you you go down to the detail of what's affecting what. And I think that's very powerful. And so back to arthritis, look, all these things affect our joints. Yes, as we get older, our joints get worn out and there's imperfections. But if you look at all the other things affecting all of our joints and forces and muscle tension and, movement problems, alignment issues, all these different things that happen in people's lives and they don't even know. And the great part is, there's solutions out there for people. So.
Absolutely.
All right. Wonderful. Well, thank you so much, Peter. It's been a fantastic conversation.
Thank you. It's been fun. We'll do it again sometime.
Absolutely. Very soon. Thank you so much.
All right.
Hey, everybody. This is the producer, Anmar here. If you enjoyed this episode, please leave us a review. If you want to subscribe to the Optimove podcast, head to www.podcast.optimovedfw.com. That's where you'll find links to subscribe on Spotify, Apple Podcasts, or wherever you listen to podcasts. Once again, that's www.podcast.optimovedfw.com. To learn more about Optimove, our practice, go to www.optimovedfw.com. And lastly, if you're in the Dallas-Fort Worth area, give us a call at 214-712-8242. That's 214-712-8242. Thanks for listening, and we'll catch you in the next episode.